And the doctor was like, have you heard of the bone marrow transplant? And so I had heard briefly about it, and they were like, I just didn't think it was an option for me. And so they said, yeah, let's test your sister and see if she's a match. And she was not a match. I had to repeat semesters. I had developed a condition called avascular necrosis, which is the death of bone in the hips. And I received some in my shoulder, but mainly in my hips. And there was one time in college where I was in my room. I had just gotten off of what I believe was pneumonia, or I didn't know it was pneumonia at the time. I thought it was just a flu, but it was pneumonia, and I would get pneumonia a lot. With sickle cell, you are immune compromised, so you get a lot of illnesses. And I was just, very tired, very weak. And I remember my mom visited me, and thankfully she did visit me because she realized she saw something wasn't right. So I remember my mom seeing me, and I could not. It was so hard for me to walk. Like, it was painful. It was so painful that I had to call a friend who also happens to have sickle cell. So I knew he understood. And this is a weird thing. I finally met people at college that had the same disease as me. And that was nice. And he was a very supportive person, very nice person. And so I called him and I said, I can't move. And we're trying to get me to the car. I was living in a college apartment. So it was a bunch of stairs. I think I was in the third or fourth story. And I called him. I was like, you have to help me because I can't move. I can't really walk. When I walk, it's like I'm gonna fall. It's so painful. So he carries me down the stairs into my mom's car, and we drive. My mom drives me from Gainesville to Orlando because we had been at the Gainesville hospital, but we just felt like they weren't listening to my concerns. And I had I can go on another podcast about the forgiveness of certain medical professionals that have dealt with me with sickle cell, and how I've had to forgive and let go of those instances. But yeah, we flew there, we went to Orlando, and I'm just trying to get admitted. And the nurse is like, well, did you take any medicine? I was like, yes, I took medicine. She's like, people with sickle cell, they need to take care of their the pain before then so that you don't waste your time here. And I said, ma'am, I've been in pain for 5 days straight. And when I told her that, she just was silent because she thought I just had pain. I told her I have been having pain for 5 days straight, and I'm actually not coming from Orlando. I'm coming from Gainesville. So when she heard that, she humility came over, and she, took me to where I needed to go, and I was admitted to the hospital, and I was finally diagnosed after x-rays and stuff. It felt like something was broken, but obviously there's no visible injury. So they finally said, oh, you have vascular necrosis, but there's nothing we can do about it because you're really young, so we can't do a hip replacement. So you're just going to have to, take some, just basically what I do with sickle cell, just take some medicine and, hopefully it gets better. But they're like, at the stage, it's not that bad. And I was like, it's not that bad. I couldn't walk. And so I've always had issues with my hips since then. And recently I just had surgery, 2 surgeries. Thankfully I had my hip replaced, and that has helped significantly. But that was literally almost 10 years after being diagnosed with avascular necrosis. So I went through a lot of complications with sickle cell, and after college, I obviously continued going through things. I wanted to enjoy my life. I wanted to travel. But every time I would travel, I ended up in a crisis. I have a video of me going to Hawaii. I don't know if I ever mentioned in that video. I had to go to the hospital in Hawaii. I had to go to the hospital, and every time I have to explain to them sickle cell, and some people would know, some people would not know what I was talking about. And I don't look like there's no physical injury, there's no bleeding, there's no scars, there's nothing. So it looks like I'm just being dramatic, but no, it's real. Look it up. It's a real illness. So I felt like it limited me a lot, but I was always determined to continue living my life. And I think that's one testimony, is that I didn't allow sickle cell to stop me from getting my degree, from moving to Chicago to learn how to code. Chicago's cold. Usually we don't do well with the cold, but I said, no, I'm going to go there. I'm not going to let sickle cell limit me in my education and experiences in life. I'm going to keep going. And maybe I look like I handle it well because no one would suspect that I have anything. But inside I am screaming about this. And then I would also, so when I finally got my real job, I felt like, I finally was accepting of the fact that, okay, I have this disease. Yes, it stinks. Yes, I have to go to the hospital. Yes, I have a low hemoglobin. Yes, this and that. But I accept that this is just the way it is, and God is going to do whatever he wants to do in my life. So I just surrender to him, and I allow God to do whatever he wants. I still kept praying, but my prayers for sickle cell to be removed were less and less as I got older. And I remember I had another crisis. I think I was 28, 29. And they sent me to certain hematologists do not seem to care about sickle cell like that. So what they've been doing recently is they've been sending sickle cell patients to nurse practitioners. And I was kind of offended at first because, this is a real disease. Why am I seeing a nurse practitioner instead of a hematologist? I've always seen a hematologist. So I, was kind of upset and annoyed. And the nurse practitioner that I had, she was a very short black woman. She's like, I have a lot of sickle cell patients. I know what you guys are going through. I know. And, I felt heard and seen by her. So I kept listening because, usually a lot of health professionals, I remember, advocating for myself. And I remember prior to that, I was seeing another hematologist, and I kept thinking about the bone marrow transplant. I asked him about it. I was like, what do you think about, the bone marrow transplant? Like my sister, she was in a match, but, is there a way I can get on the registry, or is there a way I can? And he was like, your sickle cell is not that serious. And he just basically shut me down. And I'm like, really? Like, I felt so sad. Like, you're not taking me seriously? Like, I have a 5 hemoglobin. That's not normal. I'm constantly out of breath. I have a lot of pain. I had my gallbladder removed at 11 years old. My spleen is not functioning well. I've had organ damage. I've had a pulmonary embolism. I've had a lot of health issues, and that are very serious. I've had pneumonia more times than I can count on my fingers and toes. I've had several blood transfusions. I mean, what more do you want for this to be serious? And he just dismissed me. And I never saw him again after that. I never saw him again. When they asked me the next few times that I were hospitalized, do you have a hematologist? I said, no, I don't have one. And that was kind of true because I don't know if there's something, like maybe a change in my insurance or something like that. So maybe that's why I was like, no, I don't have anyone. And so they referred me to the nurse practitioner. The attending hematologist at the hospital was the typical hematologist, but he just did not, he was very dismissive of me as well. So he just sent me to the nurse practitioner. But the nurse practitioner, to my surprise, was very knowledgeable about sickle cell. She knew about what was going on. And she said, have you ever thought of the bone marrow transplant? I laughed in her face. I was like, yeah, and it didn't work out. Like, my sister's not a match. And she's like, I think you should go to Tampa. I know these doctors that do it, and you should just, see. And I went in, and I thought they were going to just tell me, yeah, it's not possible, because I really thought it was a ridiculous thing. Like, it's not possible if your sister's half match. And I told them, I was like, my sister's half match. She's not, like, full match. And back then, you couldn't do the bone marrow transplant unless you were a full match. And so I went and did the testing, and then I sent my sister to the testing again, and they're like, she's a half match, but we can do it. And I said, what?